What's going on, guys? It's Jimmy here. Got some breaking news and a new update here on food stamps SNAP for over 40 million Americans and veterans and seniors. Also, we got some big news here on the government shutdown and also the healthcare subsidies, which will affect millions and millions of Americans' premiums on healthcare. We got a lot for you guys here in this video, and we're going to cover it all right now as we are live right now here on the YouTube It's Jimmy Show. Let me know if you can see and hear me. Type yes in the chat. Let me know where you're tuning in from. You can let me know your city, state, or even your country, as we have people tuning in here from all around the world. Don't forget to hit that like button, and if you haven't yet, subscribe down below so you don't miss out on future updates. Take a look here. Congress on pace to break the previous government shutdown record of 35 days that happened during President Donald Trump's first presidency. Quote, utterly shameful. Congress to crush U.S. record for this week, this week for the longest shutdown ever. That previous record government shutdown of 35 days was back at the end of 2018 to early 2019, lasting 35 days, which included a fight over the border wall funding and also involving furloughs during the first presidency of President Donald Trump. Now, the Trump administration is saying that SNAP will be partially funded in November. The key word partially funded here, after two federal judges ordered that they must be paid. And here are the details that have just come out here today. President Donald Trump's administration said today that it will partially fund SNAP for November after two judges issued rulings requiring the government to keep the nation's largest food aid program running, which includes a lot of seniors, children, and over 1 million veterans. The USDA, which oversees the SNAP food stamp program, had planned to freeze programs starting November 1st because it said it could no longer keep funding it during the federal government shutdown. The program actually serves about 1 in 8 Americans and is a major piece of the nation's social safety net. It costs more than $8 billion per month. $8 billion per month. The government says that it has an emergency fund that will only cover $4.65 billion, enough to cover about half of the normal benefits. Exhausting the fund also potentially sets the stage for a similar situation in December if the shutdown isn't resolved by then. Let me know in the comments section if you think we'll see the government shutdown go into December. We'll get to some details here on that in a second and what Republicans are saying here. It's not clear exactly how much beneficiaries will receive, nor how quickly they will see that. I'll give you the details here on that here in a second. As November payments have already been delayed for over 40 million people. Now, the Trump administration Treasury Secretary says food benefits could flow by as early as Wednesday. So they could flow as early as Wednesday. He also said there's a process that has to be followed. So we've got to figure out what that process is. However, there are more delays even expected to be made, and this is cause for concern because California Attorney General said at a news conference that it would take a state about a week to even load benefits onto cards once the funding is made available. Now, with the Trump administration saying that they could fund this as early as Wednesday, other experts are saying that that is the earliest likely best case scenario, and this could drag on for several more days or even weeks as details and all this stuff is figured out and delays, and you can just imagine what could happen if the best case scenario doesn't happen. So let me know your thoughts here in the comment section. Also, take a listen here to Republican Congressman Ted Cruz.
Will the government open this upcoming week? This is getting seriously impacting the U.S. economy. What's your take?
I think it's likely to open Wednesday or Thursday of this week. The Democrats will wait until after Election Day because they think a shutdown is good for energizing the crazies in their party. But I think it'll be either late this week or early next week.
Are you going to have to give on the Obamacare subsidies?
No, the Democrats will collapse entirely.
Texas Senator Ted Cruz telling Maria Sunday he expects the Democrats to reopen the government after tomorrow's elections. If the doors stay closed in Washington for another day, this would now tie for the longest shutdown in history. President Trump is still calling on Senate Republicans to end the 60-vote filibuster rule, pass the clean funding bill with a simple majority. Senate Majority Leader John Thune is maintaining he will not negotiate during the shutdown and supports keeping the filibuster in place to block future Democratic legislation if they regain control of the upper chamber. Joining me now, Louisiana Congressman and House Majority Leader Steve Scalise. Congressman, good morning to you. Here we go again, day 34. You did recently unveil some possible GOP priorities for a deal on health care. What are they?
Well, Cheryl, it's first good to be with you. And, you know, if you go back before the reconciliation bill, Republicans have been working on a number of really smart, proven ideas, all focused on lowering health care premiums. Of course, if you look at what the Democrats have done, Obamacare is the law of the land, and it's all Democrat policy. And it's been raising premiums, 80% increase in premiums for families under Obamacare. And that's even after they've masked it with hundreds of billions of dollars in subsidies to insurance companies. So clearly that's failed. What we want to do is do things that can actually lower premiums for families. We had a provision called cost sharing reductions in the reconciliation bill. It passed the House. It was scored by the CBO to lower premiums by 11% on families. You would get 11% lower premium in your renewal if you're a family under our bill. Democrats are the ones who went and fought it in the Senate. They had it removed in the Senate. So Democrats have never cared about lowering premiums. But those good ideas are still out there. PBM reform is something we had passed last year. We have other ideas too, you know, pooling together health savings accounts, small businesses pooling together to lower premiums. Again, every time we've come together, all of our committees of jurisdiction, we've put ideas on the table that focus on lowering premiums, and Democrats have never wanted to be a part of that conversation, unfortunately.
It's going to be interesting to see, though, how different senators or members of the House like yourself, sir, that are going to approach these negotiations, if indeed when the government reopens, we hope very soon, because a lot of these major blue cities across the country have used the Obamacare subsidies and that federal funding to offset their own budget problems. I point to Chicago, the city of Chicago. So how do you stop that? Because at the end of the day, and we go back to what the American people asked for, which was fiscal responsibility in Washington, that you stop the bailout. Obamacare was never supposed to cost the federal taxpayer what it has ended up costing all these years later. I mean, how do you even come to terms on this?
Remember, Cheryl, they named it the Affordable Care Act. You should always watch when Democrats name something. You know, the Inflation Reduction Act, remember that under Biden? Inflation Reduction Act dramatically increased inflation. The Affordable Care Act is unaffordable health care for families. And by the way, it's broken up the doctor-patient relationship. So all these states that want more bailouts, insurance companies that are seeing record profits and want more bailouts. Interesting that the Democrat Party is the one fighting to get those bailouts to those insurance companies while families pay more in premiums.
Here's one thing that's for certain, no matter what side of the political aisle you're on, or if you're just an independent or a realist like I am, is that healthcare has been going up every single year for as long as I can remember. And even since Obamacare or the Affordable Care Act has been passed, healthcare just keeps getting more and more expensive. And remember that Trump was president after that for 4 years, and Republicans didn't really do much to pass significant legislation to, improve healthcare in Trump's first term, in which there was 2 years that they had control of the House, the Senate, and the presidency, exactly like they have now, where they can pass bills through the reconciliation process, like they did with the big, beautiful bill with no Democratic votes. So I don't know who's to blame, if it's Republicans or Democrats or just Congress in general, or if it's the healthcare companies, just their greed in general. But healthcare is just getting more and more expensive, and families cannot afford to pay thousands of dollars a month, plus these huge, massive premiums for healthcare, and see them go up by double-digit inflation every single year. But if we don't see the healthcare subsidies get passed through the government shutdown negotiations, right now, even the government data and the government reports say that healthcare is going to spike up even more, unless there's some significant legislation passed by the Republicans to completely reform everything, and we see just a completely new healthcare system invented or, evolve out of this. We're going to see even more expensive healthcare. So, people can afford healthcare to begin with now. So, yeah, healthcare, food costs, tariffs. There's just so much inflation going on right now that something's got to be done. Let me know your thoughts here in the comment section, and I will keep you up to date. Also, this is very important for those on Medicare or for those who have loved ones that want to be. Pay attention. The annual open enrollment period goes from October 15th only until December 7th. If you have Medicare, this is the time to choose your new 2026 plan that works best for you. There has been a lot of Medicare changes recently, and most Medicare plans change, and many just go away entirely. Luckily, my trusted partner, Chapter Medicare, makes comparing every Medicare and Medicare Advantage option easy. They're honest, unbiased, and can review your plan and get you the best one in under 20 minutes. If you're on the right plan for your needs, they'll tell you, and if you're not, they'll help you switch. And by doing this, they've saved people on average around $1,100, which is amazing. They've helped hundreds of people from my community find better plans, and they can help you too. So call this phone number on the screen, 833-700-1320, or click the pinned comment down below in the comment section to connect with Chapter and find the plan that's best for you. So make sure to share this video so other people can get this information. If you haven't yet, subscribe down below and click the bell icon so you get notifications when we go live. I will keep you up to date. Click here to see a shocking new judge's ruling. Thanks for watching, guys, and I'll see you in